Sir,
Sir, good evening all and warm welcome to all. As we all know that this IFPH is performing daily webinar series and today is our 2013th day of uninterrupted daily webinar. Daily we are conducting 3 sessions from 7:30 to 8:30 Hindi session, 8:30 to 9:30 English and from 9:30 to 10:30 Malayalam. Sir, the host joined or not?
no, the host is fine. Our guest is finding it difficult to join. I don't know what happened. Maybe the network dropped. Anyway, we can wait for the arrival of our guest. In between, we can invite Dr. Ambaresh to say a few cases. Some of you are.
Yes, sir. Dr. Ram Parvesh, sir.
You can present the case here before the arrival of our guest, if you want. Let me check.
Guest present subject.
Sir, you can present any your experiences.
Achha.
Okay.
Yes, sir.
Thank you, Dr. Sheila and Dr. Taneji.
No.
Everyone, namaskar.
Sir. Everything as usual.
हमारे वेबिनार में प्रेजेंट है सीनियर चिकित्सक डॉक्टर कल्याण स्वरूप जी. बहुत बहुत धन्यवाद सर को. और यह टाइम जो है मौका मिला है सर.
Sir, kindly speak in English, sir.
अच्छा इंग्लिश. Main cause of disease according to law of homeopathic science, Shura, psychotic and syphilitic. Aphorism 72 and 70, organelle of medicine. This is the main cause of disease. Indisposition. First, indisposition, maintenance cause of disease. And maintenance, and second, chronic disease. Chronic disease is Shura, psychotic and syphilitic. Shura, what is Shura? Means Shura is called name of itching. Itching, body itching in external itching. But beginning Shura is a mental itching. Mental itching after external itching. So mental itching, anger, mental itching, fear, mental itching, desires, coffee, tobacco, a kinds of itching. Mental itching after external itching. And psychotic, but psychotic is a overgrowth. Yani there are two types of symptom, subjective symptom and objective symptom. Shura, subjective symptom is the thinking, and objective symptom is the eruption. Thinking is called mentality, and eruption is a Shura, externality. So psychotic, subjective symptom. Objective symptom is the overgrowth, the organs. And syphilitic, subjective symptom is psychotic nature. So syphilitic, objective symptom and subjective symptom. There are the main cause of disease, Dr. Master Handman. This is the main cause of disease, Shura, psychotic and syphilitic. So very thanks, Dr. Sheila, and present Dr. Kalyan Swarup. webinar.
Yes.
Okay, thank you.
Yes, we can invite Dr. Kalyan Swarup. Sir, you can say something about. Yes,
Hello,
yes, sir, we can hear you.
can you speak my
Yes, sir, you can speak.
Sir,
You
you
can
can
speak.
please.
actually I want to say my experience within the practical life. When I was practicing in Calcutta, I have seen a girl. She was suffering from the diarrhea or a stool. She passes a stool without the confidence. She don't know the stool is passing. No sensation during passing the stool. But after passing, when the stool a smell comes, she feels my stool is comes out. Due to that cause, she leave the school life. She go to the several allopathy doctor. When she come my clinic, I have taken full history of the girl. The age was only 6 years, and she belonged to Gujarati girl. When I taking the history, I ask her, what you like? What is your desire to particular things to eat? She told me, Uncle, I like to eat sweet. On that basis, the totality of the symptoms, I prescribe her lycopodium. But within 2 months passed away, she not get any relief. Her mother told me that, doctor, 2 months has passed away. She not get any relief too. What I can do? I say, wait. Again, I start to re-examine the upper case history. Again, I ask it, what you like? What is your particular desire? She again told, I like to sweet. Then I say, which type of sweet you like? Made of the milk or other? She told, Uncle, what do you mean by sweet? I say, sweet means mitha. She told, no. In Gujarati, sweet means salt. Salt is known as sweet. On that basis, I prescribed to her nitramure and she get relief within 15 days. So, being a homeopath, we must have knowledge about the desire and aversion, about the craving. So every student, every homeopath must be take the full history of the patient. Then you can prescribe any medicine. Without case taking is then you prescribe without case taking, your medicine will not good activate. Second history I am saying to you, when I was practice at Gaya, my own place is Gaya town, Bihar district, Bihar. A district judge consult to me. Her wife is suffering from the aphonia and severe aphonia. Some doctor, allopathy doctor, treat her, no get relief. He consult to me. I go there, I see her, and I prescribe on the totality basis of the symptoms. Calcarea carb. Calcarea carb 30. After 2 days, again I go to his chamber and say, doctor, she not get any relief after Calcarea carb. Today I am giving to you, sir, Calcarea carb 200. Judge Sahab, the senior judge, told me, you have seen Calcarea carb in my box? I have seen his box. There is Calcarea carb. I give him Calcarea carb. After giving the Calcarea carb, what I have seen, I am telling to you. A cup of tea give to me. I drink only half cup of tea. And within the half cup of tea, the patient's whole body is trembling like a severe trembling. I became very anxious and very furious. What it will going to do? I gave him Calcadia card 200, not from my side. I gave from his own box, not my side box. Within 5 minutes, she became very feels rest. What is the fault with me? I feel this is the fault with me. That day was the full moon. And I know that time I don't know that today is the full moon. And during the full moon, never prescribe Calcaria carb, never prescribe phosphorus, never prescribe silesia. So everything written in the Materia Medica, everything written in the Helensky Road, that is the golden point. Must be remembered to every homeopath before the prescribing must be tried to know. So being a homeopath, my suggestion you, every homeopath, that first you try to take a case history of the patient. Without taking the case history, you never treat any patient. If you treat any patient without taking the case history, it means you are not doing the good for that patient. This is my suggestion to all homeopaths. So every homeopath try to take the case history of the patient, then start to the treatment.
Oh, okay, sir. Thank you very much. Over to Dr. Sheila to moderate the session, and our guest has already joined here. Yes.
Yes, sir. Yes, sir. Good evening and warm welcome to all once again. I am Dr. Sheila Prem, today's moderator. Today is our 2013th day of uninterrupted daily webinar series of IFPH. And today, before starting, 1 minute silent prayer. Yes, sir. Today, our guest is Dr. Shashi Mohan Sharma, BMS, PG Homeo from London, Director and Principal of Hahnemann College of Homeopathy, UK. More than 52 years of clinical experience, and our today's topic is very important one, especially for homeopathic physicians. Selection of the medicine based on totality of the symptoms with case presentation. Sir, now we are warmly welcome you, sir. The dice is yours now. Please start.
Sir, good evening, sir.
Yes.
Yes, sir, please.
Maybe sir has said very nicely, Calcaria carb is a very good remedy for painless hoarseness. So phosphorus, all carbohydrates, almost all the drugs are painful. And Calcaria carb is a very nicely acted in where the patient has painless hoarseness, complete hoarseness, aphonia, and other things. Sometimes these contradictions are mentioned in Materia Medica, but how far they are genuine and they maybe what is the reason, what I have understood why should not prescribe those remedies at that time means they are having similar modality. When you have to prescribe the similar condition, similar disease has produced in his body, so that's why the slight intensification or the condition is worsening. So the medicine action is very quick and body reaction also very quickly to the external existing environment maybe. So that's why they are not, most of the homeopathic people are, they have read some of the people are used not only used according to their relationship, either means inimicals, all other things. So what is the caution given many stalwarts in our homeopathic system? You should not prescribe at that aggravation mode. Why? Because our drug has ability to produce similar condition. So there is a natural disease and the medicine has produced its own disease that is called artificial disease. There is a clubbing of natural disease modalities and similar artificial disease. So that's why there may be intensification. So that's why at the time of intensification or the modality clear cut you have to examine, should not prescribe maybe, I think. So here the totality the prescription on the basis of totality. Here there is even this is a very vast topic. Even many a times, many a stalwarts are explained their own views. So what is meant by totality? So simply, very simply, what is that? So it is not a quantitative, qualitative one. So sometimes, so in the case, after evaluating the totality, which one is more important? Either modalities are important, or generalities are important, or key characteristics are important. So many a times we have to develop a confusion in our minds. So sometimes patients are given very clear-cut modalities, especially suppose if we take this case, aphonia. What is the other totality? We never get from the patient totality. So aphonia, maybe it may be aggravating in the morning or evening. Sometimes certain patients are given like that, but most of the time aphonia has persisting. Patient is unable to determine which factor has influencing, means increasing her condition or decreasing her condition. What would be the cause? Here, another important factor is we have to understood in the evolution of totality. So, either it may be a modality or cause. Sometimes causes act like a modalities. Sometimes modalities may act like a cause. So, there is a need to understand either it is a modality or either it is a cause. So, in the totality of the symptoms also, the causes are present and modalities are present and some other uncommon characteristics are present. So sometimes we have a doubt. So we have to prescribe a remedy on which basis. So most of the timing, our people are prescribing on the basis of totality like that. But here, the totality gives a more number of remedies, 2 or 3 remedies minimum we will get for each totality. But in differentiation process, so we are giving only one remedy to that one. So remedy has covered almost 10 symptoms, but one characteristic symptom is a first grade. So on which base it has similar to that one, you expected result on that base only. So sometimes we have to wait. SAR has said calcarea carb 30 never gives a result, but what after prescribing calcarea carb 200, patient get worsening, it may be related to full moon aggravation like that. But sometimes we have a doubt. Most of the time we have to change whenever we have to give one particular potency to the patient, they never get the result. We can change the remedy most of the timings. We never thought we have to increase our potency or not. Maybe 100% it may not be a right step in always changing the remedy. Sometimes increasing the potency is also very a right step by understanding through our totality. When, as per my understanding, when you have to change the potency, don't change the remedy means the prescribed remedy is very strong, similar. When you have confident toward, it may be a similar to the case and the totality is same. There is no onset of any other symptoms or no other existing symptoms added to the totality. So you have confined to that one. You have to increasing the potency. We have to change. So even after increasing the potency, sometimes there are different principles or their guidelines are given by our masters. If it is a chronic case, don't change the remedy. You have to understand the miasm and to give one dose of miasmatic remedy to remove the miasmatic flora or to facial. Why? Because even though remedy is a similar, so it is a very complicated science. Homeopathy is a very complicated science. Why? Because even we thought a remedy is similar, but sometimes you won't get the result. So most of the timing we can change the remedy, but as per principle, don't change the remedy. You have to review the case, either why the remedy is fails. So remedy is fail. So that's a very important step. Either why the first prescription is fail. Most of the people thought the first prescribed remedy is the first prescription. Not like that. Why? Because we fails to get the key characteristic or we fails to gradate which one is exactly similar to suggest that particular remedy, whatever the remedy we have to prescribe in the first day or first visit. So clearly stated that one. Sometimes the body reaction is very slow. Even remedy acted on that one. So without removing the block, especially in a case of chronic disease, without removing the block. In the chronic case, there are 2 types of prescriptions are maybe advised by our masters. What is that one? Number one is the acute symptoms are more prominent. you have to give acute totality. Acute remedy. For acute totality, acute remedy. Definitely it gives relief. Suppose it fails to that one, we fails to get or evaluate the acute totality as similar to that one. And chronic totality means to remove the miasmatic block by prescribing anti-miasm or miasmatic remedy. Without that, so even though a remedy is similar to that totality, but we won't get the result. Sometimes even most of the patients, they said in the first visit, I won't get any proper result. Why? Because they are always compared with the allopathic mode or some other things. So they won't observing properly. They are stated straightforwardly. There was no result. There was no result. So we are hesitatively when patient said there is no result. So we are feeling some inferior or some other thing. Try to review that case. We are reviewing. Everyone has review. But why it fails, we never thought. We are not analyzing either patient statement is relayed or not. And again, sometimes we are changing the remedy or which one is occupy next place or which one gradient scoring highly in the repertorization process or other, we can change that one. So suppose almost the remedy is acted, the body is reacted to that one. Action and reaction is sometimes similar. Sometimes one action may be increased or reaction may be less, or sometimes reaction may be more and action. Here action means medicine, reaction means body response to the medicine. These are, you have to understood. Without understanding that one, so which symptom is disappear to first in the totality. So it tells to you your remedy is right or not. Sometimes most of the people in the totality, few symptoms are disappear. We feel yes, our remedy is acted very nicely. What I have observed in the patients also in my experience. So by prescribing original remedy to the patient, they won't get proper result. When stop that one, or when we have to prescribe placebo to the patient, patients are expressed, this medicine was worked very nicely, sir, like that. Oh, really placebos are worked as a medicine? No. Why? Because earlier medicine has acted, so the body is reacted slowly, showing response to slowly, till the time it was exerted while prescribing the placebo or like that. So that's why these are all very important steps. So not only evaluating, erecting the totality, so for prescribing the remedy, you have to analyze either symptomatic analysis and case evaluation. The entire case, what type of case it is called? Symptom means each symptom is how far important and how much gradation as scored in that particular thing. So these are all very important. On which base we have to prescribe a remedy to the patient, you have to observe, to explain the patient. This is a very better technique to get a proper result from the patient and better observations to elicit our positive action. So to explain in which aspect patient gets the result. Why? Because patient has always in the complete delusion or illusion. Why? Because complete disappearance of that, then they are getting fully result. So initially it was started, little bit relief is there and certain symptoms are disappear, certain symptoms are relieved, but those symptoms which are relieved in the totality, on which totality base we have to prescribe remedy, patient never described that one. Those symptoms which are remaining in his body in the totality, they are brought into that one. There is no result in this aspect. There is no result in this aspect. So what is the importance of erection of totality means? So totality means the total number of symptoms. So not only, sometimes only one symptom constitutes the totality, logically. One symptom, one-sided diseases are there. We not get many more symptoms act like a totality. So here constitution is there, modalities are there, causes are there, and cause and effects are there, and which one is plays an important role in that one to selection of a proper simillimum. All symptoms are not equally. That is the importance of erection of totality. Even after erecting the totality, so on this base we have to select repertory. We are erecting repertorial totality. It is quite different process, repertorial totality also. Some of the symptoms are left over. Even we will get some remedies in the repertorization result, but we are unable to prescribe. So few people are blindly following which remedy has highly scored and other things. So every level, our masters has given easy methods to understanding to prescribe a remedy, and also you have to learn how to construct the totality, and how to observe the positive. If you don't know the proper, if you hadn't proper knowledge in the construction of totality, you are unable to understanding the curative process. Why? Because in the totality, number of symptoms are there. There are few symptoms are reflecting entire constitution or entire disease process. A few symptoms are a part and parcel of the disease. So few are common in that particular disease or an individual, or fewer. So if you are not analyzed properly the totality, so that's why looking like a picture that in the sixth aphorism Hahnemann was mentioned. So it is a conceivable portrait of the disease. Conceivable portrait of the disease. Portrait means a complete picture. All human beings are having two hands and hair, two eyes, like that. If you are looking like all are equal look, but from the individual to individual there is a variation. So in the totality also each symptom is varied from the individual to individual and from the stage to stage. But the patient is not in a position to express their intensity sometimes, or sometimes they are vaguely expressed certain symptoms, but they are more valuable in the construction of the totality. So if you are missing those, we are prescribing the remedy, but we won't get the result. Yes, even though sometimes we are prescribing the similar remedies to the case, we won't get result. So clearly explained in our guidelines what we can do those circumstances. So, or what are the things we are constitute the totality. So most of the people, what they have done, when patient comes, they are complaining of that one. So the modality, everyone has such as modalities, and everyone has such as physical generals and mental generals. Whatever the abnormalities we have to observe, they are constituting the totality. These are the only totality included in totality. But if you are going to the case taking process, many times I asked my students, is it any difference? Is there homeopathy case taking? What you have read in the clinical methods, means Hutchinson manual or Chamberlain's or some other methods are there. So is it any difference is there or not? So most out of 100, most of the students has given answer, yes, there is a difference. So what is the difference? We are asking physical generals and mental generals. Well, in the Hutchinson or Chamberlain, they have given importance to examination methods like that. But really, if you are asking me the same question, there is no difference. There is no difference. If you read in the personal history, they clearly explained what are the habits, what are the mental things. And the examination also, most of the very, very important findings we have to observe, but we are not included into the totality. So that's why sometimes we are missing what I have expressed in constitution of the construction of the totality means, constitute the totality means. So the physical examination findings and the systemic examination findings also, there is a need to including constitute the totality. But most of the timing, we are not aware, we are not using this. For example, in the X-ray is there, some consolidation is there. So, sir,
thank you, sir. It's our guest has joined now.
Yeah,
Anyway,
Thank you, Dr. Karnagar. You, thank you so much. You filled the gap actually. Thank you so
yeah,
much.
definitely.
Thank you so much.
Yeah.
Yes, you're muted. You're muted, Dr. Sheila.
Yes, sir. Warm welcome to Dr. Shashi Mohan Sharma, sir. So,
sorry for delay. There is some problem in UK. I'm trying again and again to reload Zoom, but is only on the phone. I can speak. Is that okay?
Okay, sir. No problem. Okay, it's okay, sir. Okay, sir. Thank you. Continue, sir. Please.
I don't know why this is happening in UK. Maybe they have changed the setup. So my main advice is to always find minimum based on the symptoms of the patient. And we have to take case taking for each patient every time without considering the past symptoms. We should select the remedy based on the current symptoms and the totality of symptoms. There is no other science in the world better than homeopathy, which gives you the right remedy and definite remedy. In my 55 years of practice, I always find the best procedure is to select the remedy based on the totality of symptoms. Totality of symptoms is the only guidelines which lead you to the remedy. There is no science in the world confirming the remedy like homeopathy. Homeopathy is the only science that gives you cure and give the solution to your trouble. This is based on the definite symptoms, and symptoms are the most important thing for the selection of the remedy. Are you hearing me? Is that is okay?
Yeah, we can hear, sir. Okay.
Because I know something is wrong here, weather is not good, it's raining outside, and the internet is not working properly. So my advice is to always go for the remedy after selection of all the symptoms, and symptoms are the only guidelines which gives you the treatment guidelines. The best remedy you will find by the taking all the symptoms and repertorizing it properly. Repertorization is the only method which gives you the right remedy, proper remedy, and definite remedy. In other science like allopathy and Ayurveda, they can trust the symptoms, but homeopathy is totally based on the symptoms. Without symptoms and conditions, and which may be objective or symptom subjective or objective, it will lead you to the direct to the remedy. Just like there was a case, and I tell you, heaviness in the bladder. No, nothing happened. Only there was a 4 remedies: digitalis, lycopodium, natrum, and sepia. But this was the case of the lady, and I selected the remedy sepia based on the symptoms, modalities, and her mentality. The sepia helped her, though nobody can help her in heaviness of the bladder. Sometimes we go for symptoms which are very, very special. I tell you something very rare case. The generally expectations are yellow and white, but the blue exploration just like blue is like totally like blue like ink. Arundo is the medicine for the blue and white, but the best remedy is Calibacrum. Is a bluish expectoration. It was very thick, sticky, stingy, and I was surprised to see the color of the expectoration. So I just found this remedy in Kent's repertory. So you have to trust your science and the teaching from your teachers. Another pain in the ankle that was going up. The Leadenpal was a remedy because the pain of the Leadenpal goes from bottom to up. And it was a gouty pain. So pain in the ankle, Leadenpal is the first remedy, and first grade remedy is always helping you. And when you are stepping, there is a pain in the ankle, Leadenpal is the best remedy. So we have to trust repertory, and you have to trust your science. And I tell you, in sleep, you have the dreams of beasts and animals. The pulsar relay is the only remedy for this type of symptoms, where you dream of the beast and the black beast. So no other science is better than homeopathy. Homeopathy is the only science which gives you definite remedy, definite symptoms lead to definite remedy. And one thing more, and the symptoms which are very, very important I had a patient with having the symptoms exhibited in the sun. So when you're going or walking in the sun, there are so many remedies, but entim crude is the best remedy. Entim crudum, you will see mostly white tongue and don't like heat and exertion in the heat. The direct remedy is entim crudum. There are so many things in homeopathy which no one has got. And I tell you, always trust. Numbness in the hips. The hips are called nates. Arsenicum album 200 helped the patient. And there are sometimes remedies which you give and it don't give you result. So you have to rethink, and otherwise there is a remedy, sulfur, which opens the case. If you give the best selected remedy and nothing is happening, you have to go for the sulfur. Sulfur will open the case. It may help or it will open the case for the further treatment. Homeopathy is very much definite and divine science. Pain and fever are the two major symptoms which are always a problem for the doctor. I treat many cases, but main problems are pain and fever. Pain is number one. Homeopathy is the only medicine which have the special affinity for the typical type of symptoms like pain in knee, pain in the thigh, pain in the lower limb. But what is the type of pain? Sometimes patients are surprised when they're telling, I have got this type of pain, and the doctors even don't believe how many types of pain is there in homeopathy. Burrowing, gnawing, breaking, benumbing, paralytic, so many things are there. So we have to trust homeopathy. There was the case of the gentleman on the face, there was a burning all the time, and he was having the water thirst all the time. So I gave arsenic album, it helped immediately. Hello?
We can hear, sir.
Okay, I thought we are cut off because the weather is no good here. I was worried. Sometimes the supplementary or accompanying symptoms, these are called concomitants, they are very helpful. There was a case where they're saying, I've got this problem, pain in the face, it was pressing outward. It looked like a pain is coming from the face outward. Asafoetida was the remedy. And in another case, when you don't find any remedy, but you ask again and again, you will find out the remedy. And we can cover eyes as much as no one can cover in the world. Sting pain in the eye, just like bee sting in the eye. It was no bee sting, but pain like as if it is a bee sting. Apis mellifica 200, only 3 doses made better, and pain was gone. Another thing is we have to trust only symptoms and nothing else. Symptoms are only leading to the proper remedy. In my 55-year practice, I never failed if I select a proper remedy. But sometimes we have to increase the potency rather than changing the remedy. Never change the remedy if the remedy is the same, proper. One case of phosphorus, I gave 1 m. There was no improvement, then I gave phosphorus 10 m. It was better because sometimes the remedy requires higher potency and we think the remedy is not right. So make sure when you select a remedy, it should be definitely remedy for that case. Pain in the back while swallowing was one remedy called Rustox. 200 didn't help, then I gave 1 m and the 1 m helped immediately. So homeopathy is the only science where you can find any remedy without diagnosis. Based on the symptoms, the remedy is there. Symptoms are the natural phenomena of expressing what is happening inside the body. So always trust on the symptoms and take the case properly and don't rush for the remedy. Naxomika helps in one case, will not help in another case. It may be alumina, it may be opium, it may be any remedy, antidote. So this way we can find out the proper remedy. We should not rush for symptoms. We should ask more and more and more and more. Ultimately, you will find the remedy. In many cases, the patient don't believe and they don't know the value of the thirst, appetite, modalities, and concomitant. But these are the most important things to find out and supporting us to find out the remedy. We should always take case properly from mind to generalities and generality to the peculiar symptoms. Generality is not good for hello. Hello.
Hello, sir. Voice is audible, sir.
Yeah, voice is audible, sir.
I think something is wrong in the atmospheric. The weather and the internet is very bad here. Can you hear me now?
Yes, yes. We can hear, sir.
Never discourage yourself if you don't get the result. If your remedy is right and you find the remedy after long work, it will definitely work sooner or later. In many cases, the symptoms are guiding you to a particular remedy, but you don't get results. But don't worry, you can go for the higher potency. Only in rare cases you go the change of remedy. There is a pain in the one headache, and there was a pain going to the eyes. He had the headache, but the pain is going to the eyes. I found the case again and again, and the remedy was nitric acid. So nitric acid 200, 3 doses only, relieve the pain in the eyes. Another case was Mr. Singh was having the pain in the right side of the face, trigeminal neuralgia, and he didn't have any result from any treatment. So symptoms were worse in the evening, and he liked open air, and he didn't like the fatty food, oily food, and he didn't like the heat too much. So pulsatilla was the remedy, and magically pulsatilla removed the trigeminal neuralgia. He was so happy, he sent more patients. You have to trust homeopathy. If you trust homeopathy, if you find a remedy, and you will definitely get results. We have to rely on the symptoms only. Symptoms are the only, there's a lady, another lady, she had a pregnancy and she was having the falling of hair. So she told me, I've got a falling of hair. And since I am pregnant, I have got more falling of hair. You will be surprised. The lady didn't like the heat. She was jerking in the sleep while closing the eyes. And the laxus is the only remedy. You can go and read it. Laxus is the only remedy for hair fall during pregnancy. And a lot of doctors are surprised when I told them I gave laxus for the hair fall and it got better. So you can go for the repertory again and find out particular remedy and very strange thing happening. I am so thankful to my doctors who made this repertory, and there's a pain which is the most important. There was a case of pain in the hypochondria, and the lying on the side, it was aggravating. The Rustox is a first grade remedy. You can see And rust ox is not in the particular symptoms, but I gave according to the selection of Kent repertory. The rust ox was the best remedy, only remedy in the first grade. There are so many things in homeopathy. I think you should see repertory, even if you don't need it. You read it and you will find out so many things from A to Z. Hundreds of things are there. Doctors don't know, we don't understand. If your problem is there and you know the remedy, there was a pain in one case, it was always at noon. There is a one book called Time Phases and Moon Phases, but I found the remedy at noon. He feels better, is a brainia. Brainia is better by pressure, and brainia is better by afternoon. He had the pain better in the afternoon only. So brainia is the first grade remedy. And in head, there was a crust ulceration. I thought it's a miserium, but surinum was a better remedy. The surinum, it was a dry, not wet. After 2 weeks, the head was better, and this thing, eruptions on the head and crust all gone slowly. So always trust homeopathy, because it's not one day thing. On mind, very important homeopathy. You should go for the mental symptoms. You will be very surprised when you see there's a sensitivity of the mind, very oversensitive after drinking coffee. Chamomilla is the only remedy for drinking coffee, and then you are oversensitive or sensitive. So coffee is no good. I know coffee is very vibrating, but sometimes coffee gives the symptoms for the direct remedy. Regarding so many complaints in the bladder, most important symptom, cancerous urination, burning during urination. Cancerous helped immediately. No, nothing could help him. Cancerous was the only remedy that I gave 203 doses for 3 days, and he was better. And the pain in the bladder while walking or jarring. Jarring and walking, belladonna is the main remedy, first grade remedy. And pain in the bladder during menses is a very special symptom of sepia. So you should always see Kent repertory. You will find so many remedies are there, but the top grade remedies are very much important. I had one book from Dr. Kunjali. He gone through the whole repertory and gave the black marks. The black marks means the tested is confirmed by the author. If you have any chance, you can go and see Kunjali's repertory. Very, very important. Because our job is to tell you what is good for you for future. And never be discouraged if you don't see the result. Ultimately, you will get the result. The problem is understanding the science. There is no science in the world better than homeopathy. But I am so sad to know that some companies are making combinations and formulas, and they're selling it, and they're asking doctors to prescribe them. Never prescribe combination medicine. If it's full a case, you will not get a result even after you give a single remedy in future. In one case of eczema, they were giving graphitis, sulfur, and dim crude, so many remedy in one dose. That's not a homeopathy. Homeopathy means single remedy, single dose of the good potency, or maybe you need higher potency. Just like Dorothy Shepherd, she gave hypertension to a patient while traveling in the train. She didn't have the low power medicines. She had 10 m, 50 m set. And she was so convinced, she made the book Magic of the Minimum Dose. Dorothy Shepherd from America. So please go for the master and see how they have given us the good news. Pain in the eyes after stool. Natrium carb, surprising. Pain in the eyes as the burning after stool. Nothing to do with the stool, but after stool, natrium carb is a remedy. Very surprising. You will find all these only in the Kent's repertory. And Dr. Kent was one of the best, very hardworking. And his life was very, very dedicated to homeopathy. Another thing I'm telling you, never lose confidence if you don't get result. Go and find the remedy again and again. So whenever you have got any problem, go to the repertory and find the remedy. Mind is very sensitive, but sometimes mind is sensitive in the evening. Calcarea carb is the only remedy. Sometimes we don't like people. Certain people you don't like. So remedy is for that natrium carb. If you don't like certain people. Very, very surprising. Nobody can do. And moonlight. Antimcrude is very good remedy for when people are sentimental, especially in the moonlight. Felicia in the biochemic and antimcrude in homeopathy. I am surprised. I am so happy that all through my life, I was trying homeopathy and giving homeopathy. And symptoms are very, very special. In homeopathy, a definite symptom is the most important in the 3-grade board listing. If you have the gas in the tummy, if the full tummy is the china, here and there is the lycopodium, gas right side, left side. And what are the most important? After breakfast, there is a flatulence. Natrum sulf is the most important remedy. So you should make a note of these things. What is special in homeopathy? Pulsation in the rectum. Lachesis helped. It was very important symptom. Pain in the rectum, as if somebody is hitting there. Small hammer. You will be surprised how much effort they have done. And time factor is the most important. 6 p.m. Rust ox is the remedy for the 6 p.m. 10 a.m. Natrium is the most important remedy. 11 a.m. Sulfur is the most important remedy. Time factor is nobody knows. We can select the remedy during the time. 7 p.m. is also lycopodium. Very surprising. Time factor, very good. If you know what you have to give, then you can treat the case. During menstruation, if there is a cold feeling and cold perspiration, Veratrum album is the main remedy. So I advise all of you to always look for the repertory. And best repertory is the Kent repertory, systematic and organized. So any question from anyone? Any question? Hello?
Yes. If anyone asks any question, please ask, sir.
Only a few minutes left, so you can ask me any question. I will try to reload the Zoom again, and I will do it proper next time.
Don't worry, sir. We can you can upload the Zoom in your laptop once again, and then we can have another session in this.
Actually, Dr. Dinesh, I'm sorry I moved the office from top to the ground floor, and since then everything is out of control.
But anyway, Dr. Kalyan Swaroop, Dr. Karunakar and
Ram Pravesh, sir.
Ramesh sir has given their experiences in this forum. All our doctors in medicine, how to move forward, and when you find it very difficult to move after giving the right remedy, even without result, then what can do? Then how we can proceed, and then if you give the if you change the potency, then you may get the result like that. Anyway, that was a very good session indeed. Even though sir was joined late, your cases are also very good. That's what I would like to say, sir. Dr. Kalyan Swaroop, sir, can you say something on today's session? Please unmute.
Please unmute, sir.
Hello.
Yes. You're still muted.
Yes, hello.
Phone is muted, sir.
Yes, sir. Anyway.
Thank you so much, sir. Even though the weather condition is adverse, but you join with us. Thank you so much on behalf of IFPH. We are giving you the heartfelt thanks to you. Come again, sir, another time, please.
I will try to reload the Zoom and
Yes,
make it
sir.
perfect. I will do it properly.
Okay, so thank you so much, sir. Thank you.
Thank you for everyone. Have a nice day. And I hope the evening will be good for you. And we will all serve the community with full support. From my experience, I tell you, homeopathy is the only science which can help you better than any science in the world.
Yes, sir.
Thank you, everyone.
Okay,
Yes,
thank
sir.
you all who participated in this session. And then I think we are late also. We are handing over to the Malayalam session. Dr. Shaila, please.
Before that, there is
Thank
an
you.
announcement for tomorrow. Tomorrow we will have a session from Dr. Patavi Sitaraman, and Dr. will be talking about management of male infertility with homeopathy.
Thank you, Dr. Dinesh. You are doing the best. I support you fully.
Thank you, sir. Thank you, sir.
Thank you, everyone. Thank you, everyone, for doing good job.